Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi, I'm Dr. Lisa Hernandez, and I'd like to welcome you to Your Health television program on AMP Cable Television Channel 24 and on the web at ampmedia.org. I'm your host today, and my guests will be sharing valuable information to help you improve your health. Today, my guest and I will be speaking about teen pregnancy. May is Teen Pregnancy Awareness Month, and I'd like to take the opportunity to talk about this critical issue. During the past 20 years, the rate of teen girls giving birth has declined by nearly 40%. That's good news. However, teen birth rates in the United States are up to 9 times higher than any other country in the developed world. Every day, about 1,100 births occur to teens. That's the bad news. TV, the music, the internet, and other popular media tend to glamorize teens having sex and teen parenting, though the reality is starkly different. Having a child during the teen years carries high cost to the child, to the parents, and the community. There's emotional, physical, and financial cost as well. For example, teen mothers and their babies are at increased risk for such medical issues as premature labor and delivery. And they also have a diminished risk to build a brighter future. Did you know that girls born to teen parents are almost 33% more likely to become teen parents themselves? My first guest is Rose Cologne. Rose is the Maternal Child Adolescent Health Coordinator, MCAH Coordinator for the Monterey County Health Department. She has worked in that capacity for about 3.5 years. One of the priority areas for MCAH, Maternal Child Adolescent Health, is teen pregnancy prevention, more likely. Welcome, Rose, and thank you for taking the time to speak with us today.
Thank you. I'm so happy to be here.
Thanks. Well, you heard in my introduction some of the reasons that we are covering this topic today. What are some other reasons why this topic is so important?
It's an important topic because we need to continue to create community awareness. The community is aware of the program, and the problems, but they're not jump into action. And we really need to excite some jump into action where the community also becomes involved in some of the teen pregnancy prevention efforts. And we also want to create or elicit support for teen pregnancy prevention programs in Monterey County.
And why is teen pregnancy an important issue for the community?
Teen pregnancy prevention for Monterey County and unlike other communities have huge societal impacts. One of them is the financial obligations, the cost to support the child. Mom may drop out of school, so her annual income is going to be very reduced. You begin the cycle of poverty from mom to child, and it continues. There's also implications if mom suffers from mental health issues, or there's some drug or alcohol abuse, or some postpartum depression. Then the grandparents often come in. There are hundreds of thousands of grandparents who are now raising their grandchildren across California for those specific reasons. So now grandparents now have to deal with child care cost. The family has to rally together to support this child. So it really affects. It's a ripple effect. It's not always positive. And we really want to keep kids in school. We want them to be educated before becoming a teen parent. They're not equipped mentally, emotionally, or physically to do it.
So what you mentioned, one of the things I heard you say is that you don't have to be a teen, you don't have to be a parent of a teenager to be impacted. It could be anyone in the community, a grandparent or another individual who is not family member of a teenager that it also feels the effect of teen pregnancy.
Absolutely.
So, talking about community, what is the extent of teen pregnancy in the community that we know from what we've heard from the community?
Well, some of the extent of the teen pregnancy is really is looking at ways to really combat the problem. One of the problems is it's very ingrained in cultural. So some of the issues are it's culturally acceptable. We have a high teen birth rate in Latino females, and one of the things is that we really don't see the conversation that parents are having in that community with child to either prolong the first initiated sexual activity, or to talk about the discussion about birth control in our cultural.
So it's tough for probably any parent, but more in particular for certain ethnic groups to talk about sensitive issues like sex.
Absolutely.
And what else have you heard from the community? I know that one of the things the MCH, the Maternal Child Adolescent Health Program, does is do certain assessments in the community.
Right. Every 5 years, MCH conducts a community-wide, county-wide needs assessment, and we always identify the top 3 concerns and issues of the county. In 2000 and in 2005, the concerns for Monterey County, one of the concerns was teen pregnancy and teen birth rate. So it continues to be a problem. 10 years looking at it, it hasn't removed off the list. It continues to be a high problem and one that we struggle with all the time on how to reduce those numbers and reduce the risk.
So that's interesting. We have, on one hand, parents feeling uncomfortable with talking to their teens about sexual behavior and sexual concerns, and the other, the community knows it's an issue. So you'll be here with me in the next segment to talk a little bit about prevention and some of those tools that maybe can be used to help kind of bridge that gap to help reduce the teen pregnancy rate. But definitely something to consider.
Absolutely.
Another thing we've heard from the community, what about some of the data that we collect? One of the things we do at the health department, of course, too, is collect data from, say, the birth certificates. And what are we seeing with the data in Monterey? How do we compare to the state? How do we compare to the nation in terms of our rates here?
Well, nationally, the rate is at 34%. That's a teen birth rate. State is at 29%. We are significantly higher at 54.9%. Very high, in fact.
Say those numbers again. The state was at what?
State is at 34.3%. And I'm sorry, state is at 29%.
29.
Nationally, we're at 34.3%. And Monterey County is even higher, significantly at 52.5%.
Wow. So California is doing better than the nation, though any number is too high. But Monterey is doing worse than the state and the nation. Any clues, any reasons why? Or one of the things, I guess I should say, it looks like we're looking at our numbers kind of driving our California's numbers up.
Absolutely.
Are there any other counties? Are we alone?
No, we're not. We rank number 6 on a list of top 12 counties that have not had any decline in a 3-year rolling average. There are 25 communities, 25 counties that have had a rolling decline in 3 years. We're not one of those on the list. We're actually top 6.
Yeah, so this is a time that we don't want to be number 1 or in the top 10.
Absolutely. We want to remove ourselves off that list.
Yeah.
We want to show some improvement.
When you drive down to Monterey County specifically, are there any specific areas in the county that are, some would call hot spots, where you see more areas of concern, where the teen pregnancy rate is higher?
Absolutely. We call those our hotspot areas. We have several in Monterey County, and through the data we can tell you that the community of Greenfield is one of them in South County. Pajaro Valley is one of them, and also East Salinas. These 3 traditionally have high teen birth rates.
So just for everyone's purposes, Pajaro is where? How do you define
Pajaro is up in North County, and we talk about the area right before you cross over the bridge to Santa Cruz County.
Okay. So those 3 areas are the hot spots. Any ideas as to why we're seeing higher numbers there in our teens?
There's a complex, multifaceted reasons, many reasons. I mean, we can talk about some areas in Greenfield that there's an indigenous population, and in that population, motherhood is considered very young, is not taboo. And most of these pregnancies are done by adult males, and in that cultural, that's very acceptable. So we have some teen birth rate numbers because of that pocket. Mm-hmm. In Pajaro, we've done some teen surveys, and they attribute it to everything from a lack of access to clinics, lack of access to education and information, condom use, and also nothing to do. Out there, nowhere, and no other information out there. For East Salinas, we have a different story. It could be many things. It could be attributed to, could be tied to a partner that's an older adult, that's maybe a gang member. We know violence and teen pregnancy go hand in hand. Yeah. So there's many contributing factors to that.
And what about ethnic groups here in the county? I know we talked a little bit about that already, where there may be, I think that's a national trend, but do you see that there's specific ethnic groups? And I'm not, I want to point it out more so to kind of get a better idea what some of the risk factors are, where we can target our messages and to.
So for us in Monterey County, it's Hispanics with a higher teen birth rate than whites, blacks, Asians, any other race. It's been traditionally so for the last 20 years. One of them, again, goes back to cultural. Parents in some families think that if I don't talk about it, then it won't happen. And that's some of it. It's taboo. It's a taboo subject. It's off the table. And it's also, you know, the parent-child communication at that level is, it's not going to be, it's not going to go what their religious beliefs are or anything else. So they're more apt not to talk about those tough subjects.
So in general, for the nation, for California, for some counties, teen pregnancy rate is going down. For Monterey, we've decreased some, but not enough. I think that's pretty much the case for every place in the nation. We see some areas in Monterey that are higher, those 3 hot spots, and they have different reasons for having higher rates. Any areas of hope that you might think of? I know we're going to talk a little bit more about prevention, but you know, I was driving here to the program and just hear different programs, though I hear I should listen to a different radio station, but is that you just hear lots of different messages on the media, from commercials to the songs. Any thoughts on like what are some of the things that we can do to kind of, and I guess we could carry that on to our next segment.
I think you hit it right on the nail. The media messages are so important. A lot of them talk about the lack of self-respect for young women, and they listen to those. And it's okay to, when they hear young women be called names, you know, street names that are not what we would consider to be inappropriate and really offensive. Young girls don't get that message anymore about being offensive when young males talk to them in degrading tones, and so I think it's part of that. They become accustomed to it.
Well, thank you, Rose. I think this topic is very important. Thank you for framing the issue. We know those numbers are decreasing slightly. We've got to get better. I think this might be a good time. We'll take a break to kind of switch gears and hopefully talk about some good things that are going on in the county. Thank you again, Rose, for coming to talk today and for sticking around for the next segment. I've learned a lot about the data so far, and we're going to take a short break. I'm Dr. Lisa Hernandez, and this is Your Health Television program. Don't go away. We'll be right back.